We've all seen it on TV, right? The dramatic hospital scenes, doctors
Hmm.
yelling clear, shocking a patient back to life.
Oh, yeah.
But have you ever wondered, what if the patient didn't want that? What if they'd chosen a different path?
Mm.
That's what we're going to explore today, the world of DNR orders.
Do not resuscitate.
Exactly.
It's a topic that can be tough, but so important. We're talking about choices, big choices, about our own lives, even at the very end.
That's where we're diving deep into DNRs, the ethics, the legalities, the human side of it all. But before we go any further, huge thanks to London HeartbeatsZ Academy for supporting this deep dive. Over 150 healthcare courses, incredible stuff.
Wow, that's amazing.
And for our listeners, be sure to follow them on social media, Facebook, Instagram, Spotify, and YouTube. You'll get all the updates, and you won't miss future discussions like this one. Okay, back to DNRs. What exactly is a DNR order?
Well, a DNR order, it's a medical directive. Basically, it instructs healthcare professionals not to perform CPR, if a patient's heart or breathing stops. But it's really important to understand this isn't about giving up. It's about respecting a patient's wishes, making sure their end-of-life experience, well, it's what they want.
So it's not a death sentence. It's more like guidelines.
Yeah, a good way to put it. Having a say in those critical moments. It's interesting, though. DNRs, they're relatively recent in medicine. The American Heart Association introduced them in 1974.
Really? That recent? Seems like something so fundamental, about life and death.
Mm-hmm.
Why then?
Well, CPR has been around since the 60s, but doctors, they started realizing it wasn't always a happy ending.
Right.
Some patients were revived, sure, but others, they had complications, or their quality of life, it wasn't the same.
It's not just about surviving, is it? It's about surviving well.
Exactly. And that brings us to a big question. When is a DNR order actually appropriate?
What are the things to consider when making that decision?
There are a couple of key things. First, the likelihood of CPR working. If the chances of restarting the heart are slim, well, a DNR might be the most compassionate choice.
I see.
And second, the potential burdens of CPR, prolonged suffering or severe complications.
So it's a balance, benefits versus the potential harm.
Exactly. Let's look at an example. Imagine a 56-year-old patient. History of heavy smoking, diabetes, advanced kidney disease. They've been battling lung cancer, had a major heart attack a year ago. Their heart's weak. Now they're hospitalized, severe chest infection. This is a situation where a DNR discussion is appropriate.
Yeah, their health is already so fragile.
Right. The benefits of CPR, they might be outweighed by the risks.
What about another example?
Okay, let's say a 78-year-old patient. Type 2 diabetes, high blood pressure. They develop septic shock from a chest infection. Kidney and liver functions are compromised. Again, a situation where CPR might do more harm than good.
These examples, wow, really show how complex these decisions are. It's not just life or death. It's about the individual, their circumstances.
Absolutely. And at the heart of all of this is patient autonomy.
Now, I've heard that term before. What does it really mean?
Patient autonomy means individuals have the right to decide about their own medical care, including life-sustaining treatments like CPR. It's about respecting their values, their beliefs, everything.
So even if a doctor thinks a treatment's necessary, the patient can say no.
Exactly. And it's not just ethics, it's the law. The Patient Self-Determination Act of 1991, it makes it clear, legally, patients have the right to accept or refuse treatment.
That's empowering.
It is. It's about patients being active participants in their healthcare journey.
This all makes sense. But how do people make these decisions in advance? You can't predict when your heart might stop.
Right. That's where advanced care planning comes in. Everyone should think about this, no matter their age or health.
Advanced care planning sounds a bit like fortune telling for your health.
Haha, not quite. But it does involve thinking ahead, putting your wishes down in writing. There are two key tools for this: living wills and durable power of attorney for healthcare decisions.
Okay, I'm listening. Tell me more.
A living will, it's a document. You outline your preferences for medical care if you can't make decisions yourself, like whether you want life-sustaining treatments, CPR, things like that.
So it's like instructions for your future self, just in case.
Exactly. Then there's the durable power of attorney for healthcare. You choose someone you trust to make medical decisions for you if you become incapacitated.
Got it. You have your written wishes and someone to advocate for those wishes if you can't. That's actually pretty reassuring. But are things always this straightforward?
You're right. There are ethical considerations that make these decisions more complex. more challenging emotionally.
I was hoping you'd say that. What kind of challenges are we talking about?
Well, one common issue is conflict between a patient's wishes and a physician's judgment, about medical futility.
When you say medical futility, you mean?
Sometimes a doctor might believe CPR won't be beneficial, even if the patient or their family really wants it.
So it's respecting the patient's autonomy versus the doctor's professional opinion.
Exactly. Navigating that gray area can be very tricky. Let's look at a real-life example. Mr. H, a 24-year-old man, quadriplegic after a spinal cord injury. Cognitive function is normal, no respiratory problems, but he's admitted with pneumonia.
So a young man with serious challenges.
Right. The doctor recommends antibiotics, chest physiotherapy, hydration, but also suggests a DNR order, citing medical futility.
Meaning the doctor thinks CPR wouldn't work.
That's the doctor's assessment. But Mr. H is conscious. He can make his own decisions. His quality of life, even though it's different, it's still meaningful to him. It raises a big question: who decides what life is worth saving?
That is a profound question. It really hits home the ethical weight of these decisions.
Absolutely. Let's look at another case. Mrs. W, 81 years old, advanced colon cancer spread to her liver, admitted for chemotherapy.
So a woman facing a serious illness.
Yeah. Because of her prognosis, the doctor suggests a DNR, but she insists on being a full code.
Meaning she wants full resuscitation efforts.
Yes. She's choosing to fight, despite the outlook. Powerful, isn't it? But it raises questions, too. Patient autonomy versus medical realism. The doctor wants to respect her wishes, but also needs to be honest about her chances and the potential suffering CPR might cause.
It's such a difficult balance, isn't it? Honoring someone's wishes while being truthful about the medical reality. But what happens when those wishes clash with what's ethically right? Where do you draw the line?
That's when things get really complicated. Sadly, sometimes healthcare providers might use slow codes or show codes to deal with these tough situations.
Slow codes and show codes. I'm not familiar with those terms.
A slow code? It's a half-hearted resuscitation, like going through the motions but delaying things, making the CPR less effective. A show code is a performance, really, to appease the family, even though everyone knows it's unlikely to work.
That's disturbing. Pretending to do everything while knowing it won't make a difference.
Sadly, yes. Both practices. Very problematic. They erode trust, they violate informed consent, it's deception.
Yeah, those are major ethical red flags. So if those tactics are off the table, how should healthcare providers handle these situations? What's the right way to approach DNR discussions?
The key is communication. Open, honest, and compassionate. Between the patient, their family, and the medical team.
Sounds simple enough, but I bet it's hard to put into practice.
You're right. It takes skill, empathy, and a willingness to have tough conversations.
I definitely want to explore those conversations more. How to approach them effectively. But for now, I think we've covered a lot. Let's take a break and come back for part 2. We'll delve into the practical side of DNR orders then.
So yeah, like we were saying, open communication, it's really the key. It's about sensitivity, understanding where the patient is coming from.
I get that, but what does that actually look like? How do you even start a conversation like that, especially with such a sensitive topic?
That's a great question. These conversations, they shouldn't be a one-time thing,
Yeah.
Ideally, they should start way before any health crisis.
So you mean planting the seeds early on, not waiting till someone's already in the hospital?
Exactly. It should be part of routine care. A doctor can bring it up gently during checkups or when discussing treatment options for chronic conditions. It doesn't have to be this big, scary thing.
Okay, I see. It's less daunting that way.
Yeah.
But let's say we are in a situation where it is the first time, maybe in the hospital, a DNR discussion needs to happen. What makes a successful, ethical DNR conversation in that case?
Well, the first thing is making sure the patient or whoever is making decisions for them has decision-making capacity. They understand what's being talked about, they can weigh the risks and benefits, and communicate their choices.
So basically, they're informed and capable of making a decision, one that aligns with their wishes.
Exactly. Then the physician needs to explain CPR, what it actually involves, the procedures, the potential benefits, and just as important, the risks, the complications. Honesty is key here. Be realistic about the chances of success and the potential quality of life afterwards.
No sugarcoating.
No. It's about a realistic picture. And just as important, understanding the patient's goals, their values, what matters most to them at this point in their life, their fears, their hopes. What quality of life would they consider acceptable? It's more than just the medical facts, it's shared decision-making.
So really listening to the patient.
Yeah.
Understanding their situation, their priorities.
Exactly. The doctor presents the options, answers questions openly, and guides the patient. but without imposing their own values. It's a lot of responsibility, which is why good communication skills are so vital in healthcare.
It's a balancing act, isn't it? Medical expertise with respect for the patient's choices.
It is, and it's not just the doctor's role. Patients and families need to be proactive too, express their wishes, ask questions.
It's a two-way street.
Yeah.
Yeah.
And it brings us back to advanced care planning. Having those early conversations, writing things down, choosing a healthcare proxy, it can make all the difference.
Advanced care planning seems like the best way to navigate all of this, taking control of your health care, even when you might not be able to speak for yourself. But things don't always go to plan, do they? What happens when there's a conflict? Like between what the patient wants and what their family wants.
That's another tough one. It happens a lot. That's where clear communication and really understanding the patient's wishes, ideally from those advanced directives, is so crucial.
Break that down for me. Let's say a patient has a DNR, but their family, they're adamant about CPR if something happens. How do you deal with that as a healthcare provider? That kind of conflict when everyone's emotions are running high.
First step, acknowledge the family's emotions. Of course they're upset, they want to do everything they can. Don't dismiss their feelings, meet them where they are.
Recognizing everyone's coming from a different place.
Exactly. Then gently remind them of the patient's wishes. Explain why they made that DNR decision. That's where those advanced directives are so helpful.
Like the written instructions, they speak for the patient when they can't.
Yeah, that's a good way to put it. Sometimes it helps to involve a social worker, a chaplain, maybe even an ethics consultant to help everyone communicate, support the family.
Okay, so a team approach. But what if the family still insists on going against the patient's wishes, even after all that?
Then it becomes a legal issue. DNRs, they're legal documents. Healthcare providers, they have to follow them. In most cases, the patient's wishes, what's written in that DNR, it overrides what the family wants.
So even if the family's begging for CPR, the doctor legally has to honor the DNR.
Yeah, that's usually how it works. It's tough for everyone involved.
Definitely. But it's important, right, that legal framework protects the patient's autonomy.
Absolutely. It all comes back to having those DNR conversations early, writing down your wishes, making sure your loved ones and your doctors understand what you want.
This story I read about Jill Baker, it really stuck with me. She found a DNR in her chart, and she had never consented to it.
That's awful. A prime example of what can go wrong. When communication fails and the patient's voice isn't heard.
It's a wake-up call, isn't it?
Yeah.
We need to be proactive, make sure our wishes are known.
Definitely. Speaking of being proactive, we've talked a lot about the ethics, the emotions. But what about the practical side? How is a DNR actually written? How does it all work in practice?
Okay, let's get into the nitty-gritty. How does a DNR order actually come to be?
It starts with the conversation between the doctor and the patient, or their decision maker.
The DNR discussions we were talking about earlier.
Exactly, making sure everyone's on the same page, the patient's wishes are clear.
And then, what happens?
The doctor writes it all down in the patient's medical record. The main points of the conversation, the decision, who is there.
So it's a formal record, not just a casual chat.
Absolutely. And then there's a DNR form. Everyone signs it, the doctor, the patient, or their representative, usually a witness too. That form goes in the patient's chart so everyone involved in their care can see it.
So it's all very clear, very transparent. What about those situations where a doctor thinks CPR won't work, but the patient's demanding it? Can the doctor ever go against the patient's wishes?
That's tricky. Depends on the specifics and the laws where it's happening. Sometimes a doctor might feel ethically they can't perform CPR if it truly won't work and would only cause more suffering.
It's an ethical dilemma, isn't it? Balancing their judgment with the patient's autonomy.
It is, and those situations, they often involve a lot of discussion, ethics committees, sometimes even legal battles.
Wow, okay. What about the other way around? What if a patient wants a DNR, but CPR might actually be a good option medically?
Yeah.
Can they refuse treatment, even if it might save their life?
Yes, absolutely. That's the heart of patient autonomy. A competent adult can refuse any medical treatment, even life-saving ones, for any reason at all. And in most countries, that right is protected by law.
So it really is the patient's choice, even if it goes against what the doctor recommends. That's pretty powerful.
It is. It's a shift away from doctor knows best and towards giving patients control.
Makes sense. Bringing families back in, we've talked about how they might disagree with the DNR. What's the best way to handle those situations, especially when everyone's already so emotional?
Well, like we've said, communication is key. Be compassionate, understanding, acknowledge their concerns, don't brush them off, let them know you hear them.
It's about empathy, right? Knowing they're coming from a place of love.
Exactly. Then explain the DNR, why the patient made that choice. And if they had advanced directives, those can really help.
It's like having those written instructions. It keeps things clear when things get emotional.
Exactly. Sometimes it helps to bring in others too, like a social worker or chaplain, just to help everyone communicate, help the family process what's happening.
So it's about creating a supportive environment where everyone's respected.
Yeah. But there are times when, well, it's not so easy to resolve. But in the end, healthcare providers, we have to follow the law and the ethics and uphold the patient's autonomy, what's in that DNR.
So even if it means going against the family, the doctor has to follow the patient's wishes.
Usually, yes. These situations, they're never simple. It's about looking at the details, the laws. It's a heavy responsibility.
Wow. This whole DNR thing, it's a lot more complex than I thought. It's not just a box to check on a form. There's so much more to it, ethically, legally, emotionally.
You're absolutely right. And it shows why these conversations need to happen early, well before there's a crisis.
Advanced care planning, it really seems to be the key to it all. Giving patients a voice, making sure their wishes are followed, even when they can't speak for themselves.
It is. It's about a different kind of healthcare, where patients, families, and medical professionals work together to make care plans that truly reflect what the patient wants.
We've covered so much, but it feels like we've only just started. I think we have time for one more segment to really wrap things up. Okay, so back for the last part of our deep dive. We've talked about a lot, the ethics of DNR orders, the legal side, all the emotions involved. But before we finish, I want to go back to something, those slow codes and show codes we mentioned earlier. Kind of disturbing to think that those actually happen in hospitals.
Yeah, it is. It shows a real lack of trust and ethical behavior. It's like when healthcare providers do those things, they're not putting the patient first. They're not being honest about consent.
I see your point, but I can also see how it happens. Imagine a doctor with a family that's grieving. They're putting on all this pressure to do something, even if the doctor knows CPR won't work. How do you as a healthcare provider deal with that pressure and still do the right thing ethically in such a tough situation?
It's about communication, being a good communicator, having empathy, and never compromising those ethical principles. You have to have those hard conversations with the family. Be honest, but compassionate. Explain the situation and make it clear what the patient wanted.
So you have to be strong, advocate for the patient, even when it's really hard.
Right. And sometimes the kindest thing you can do isn't about keeping someone alive no matter what. It's about making sure they have a peaceful, dignified death.
That's a good point. Sometimes letting go is the best choice. Thinking bigger picture now, what do you think all these DNR orders, what do they tell us about how we as a society view death?
That's interesting. I think it shows we're moving towards more patient autonomy. We're starting to see death differently, not something to be scared of or avoid at all costs. People want to have a say in how they die instead of leaving it all to chance or to doctors.
It's about quality of life, not just quantity, right?
Exactly. And I think that's a good thing. We're talking about death more openly, which helps everyone in the end.
I agree. It's about breaking down the taboos, having real conversations about what matters at the end of life. Okay, so we've talked about individuals, patients, families, doctors. But what about policies? Are there policy implications when it comes to DNR orders?
Definitely. With more and more DNRs, healthcare systems need to be ready to handle these decisions ethically and efficiently. That means proper training for doctors and nurses about DNR protocols, advanced care planning, how to communicate effectively. We need to make sure they feel comfortable dealing with these sensitive situations.
Give them the tools to provide compassionate care while still respecting the patient's choices.
Exactly. And we need clear policies, procedures, to protect patient autonomy and make sure DNRs are followed everywhere, in every hospital, every setting.
So it's about a system that works for everyone, patients and healthcare providers, all working together through these end-of-life decisions. Well, we've covered a lot today, from personal experiences to ethical challenges to the bigger societal picture. If you had to choose one key takeaway, what would you want our listeners to remember about DNR orders?
That DNRs are not about giving up. They're about giving patients control, letting them make choices that reflect their values, their wishes. It's about having a dignified death on their own terms.
That's a great way to put it. It's about respect, about honoring what the individual wants, even in the most difficult of times. And I think that's the perfect place to end our discussion. But before we go, I want to thank London HeartbeatsZ Academy again for their amazing support. They're an incredible resource for anyone who wants to learn more about healthcare.
They are. Their dedication to education, to giving people knowledge about healthcare, it's Truly amazing.
So listeners, check out their website if you want to learn more. They have over 150 courses on all kinds of healthcare topics. And follow them on social media too, Facebook, Instagram, Spotify, YouTube. They're always sharing great content. You won't want to miss it.
They're definitely worth a follow.
All right, everyone, that's it for our deep dive today. We hope you learned something new about DNR orders, about planning for your future healthcare. It's never too early to start those conversations with your family and your doctors. Until next time, keep learning, stay informed, and remember, knowledge is power.